Have you ever wondered if the medications you're taking could be silently harming you? As we age, our medicine cabinets often become more crowded. A pill for blood pressure, something for arthritis pain, perhaps a sleep aid or supplement, all seemingly innocent on their own. But here's the truth that many doctors don't have time to explain. After 70, certain medication combinations can become dangerous, even life-threatening. And the most frightening part? You might be taking these risky combinations right now without even knowing it. Just last month, a 76-year-old woman was rushed to the emergency room after collapsing in her home. Her vital signs were rapidly deteriorating, and doctors struggled to stabilize her. The cause wasn't a stroke or heart attack, it was a dangerous interaction between two commonly prescribed medications she'd been taking for years. Her doctor had prescribed one, her specialist had prescribed the other, and neither physician had recognized the potential for disaster when these medications mixed in her bloodstream. In this video, we're going to reveal the most dangerous medication combinations that people over 70 should never take together. These aren't rare drugs, they're common prescriptions and over-the-counter medications that millions of seniors take daily. Understanding these interactions could quite literally save your life or the life of someone you love. Stay with me until the end, because the final combination we'll discuss is one that almost no one knows about, yet it might be sitting in your medicine cabinet right now. By recognizing these dangerous pairings, you can protect yourself and have informed conversations with your healthcare providers. Now, let's get started with the first dangerous combination. Combination 1, blood thinners and NSAIDs, the internal bleeding risk. One of the most perilous medication combinations for adults over 70 involves two very common types of drugs, blood thinners, anticoagulants, and nonsteroidal anti-inflammatory drugs, NSAIDs. Blood thinners like warfarin, Coumadin, apixaban, Eliquis, or even daily aspirin are routinely prescribed to prevent blood clots, strokes, and heart attacks. Meanwhile, NSAIDs like ibuprofen, Advil, Motrin, naproxen, Aleve, or diclofenac are commonly used for arthritis pain, headaches, and general inflammation. Each of these medications is safe when properly prescribed, but together, they create a dangerous amplification effect. Blood thinners work by reducing your blood's ability to clot, while NSAIDs independently thin your blood and irritate the digestive tract. When combined, they dramatically increase your risk of internal bleeding, particularly in the stomach, intestines, or brain, which can become life-threatening very quickly. Consider James, a 73-year-old who had been taking warfarin for atrial fibrillation for years without incident. When arthritis pain in his knees worsened, he began taking over-the-counter ibuprofen daily, not realizing the danger. "I didn't think to mention it to my doctor," James explained. "It wasn't a prescription, just something for the pain." Within 3 weeks, he was hospitalized with severe gastrointestinal bleeding that required multiple blood transfusions. "The doctor told me I was lucky to be alive," James recalled. Apparently, the combination had caused bleeding ulcers that I couldn't feel until they became severe. "I had no idea these common medications could be so dangerous together." What makes this combination particularly insidious is that many people don't realize over-the-counter pain relievers count as serious medications with potential interactions. Even more concerning, the bleeding can start without obvious symptoms until it becomes severe. You might experience unusual fatigue or shortness of breath from blood loss before more obvious signs appear. If you're currently taking a blood thinner, it's crucial to avoid NSAIDs unless specifically approved by the doctor managing your anticoagulant therapy. For pain relief, acetaminophen, Tylenol, is generally considered safer with blood thinners, though you should still confirm with your healthcare provider. Never start or stop any medication without proper medical guidance, as sudden changes can also create risks. When speaking with your doctors, make sure every provider knows all medications you're taking, including over-the-counter drugs, patches, eye drops, and supplements. Consider keeping an updated medication list on your phone or in your wallet. This simple step could quite literally save your life. Combination 2, ACE inhibitors and potassium supplements, the heart rhythm danger. The second dangerous combination affects millions of seniors taking medications for high blood pressure and heart health. ACE inhibitors, medications with names often ending in pril like lisinopril, enalapril, or ramipril, are commonly prescribed to manage hypertension and protect the heart. These medications help relax blood vessels but also cause your body to retain potassium. When combined with potassium supplements or potassium-sparing diuretics, they can create a life-threatening condition called hyperkalemia, dangerously high potassium levels that can trigger irregular heartbeats or even cardiac arrest. This combination is particularly treacherous because both components might be recommended for heart health when viewed separately. Your cardiologist might prescribe an ACE inhibitor, while another doctor or nutritionist might suggest potassium supplements for muscle cramps or to offset the effects of other medications. Without coordination between providers, this dangerous overlap can occur. Take Eleanor, a 77-year-old with controlled hypertension who had been taking lisinopril for years. After experiencing leg cramps, she mentioned it to a friend who suggested potassium supplements. "I'd heard potassium was good for you, especially for cramps and heart health," Eleanor said. "So I started taking them daily." Within 2 weeks, she began experiencing unusual fatigue, muscle weakness, and heart palpitations. During a routine blood test, her doctor discovered dangerously elevated potassium levels and immediately sent her to the emergency room. "The ER doctor told me my potassium was so high it could have stopped my heart," Eleanor recalled. "I had no idea that combining my blood pressure medication with potassium supplements could be so dangerous. No one had ever warned me." The risk increases for adults over 70 because kidney function naturally declines with age, making it harder for your body to regulate potassium levels. What might be a safe combination for a younger person can become dangerous for seniors whose kidneys can't efficiently clear excess potassium. If you take an ACE inhibitor, it's essential to be cautious about potassium intake, not just from supplements but also from salt substitutes, many of which contain potassium chloride. Always consult your doctor before taking any supplement, and be particularly wary of multi-ingredient heart health or blood pressure supplement blends, which may contain potassium. Warning signs of high potassium include unusual fatigue, muscle weakness, nausea, and irregular heartbeat. If you experience these symptoms and take an ACE inhibitor, seek medical attention promptly. This combination can become life-threatening quickly. If you're still watching this video and finding these insights valuable, please comment number 2 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Now, let's move forward. Combination 3, statins and grapefruit juice, the muscle breakdown risk. Our third dangerous combination might surprise you because it involves something completely natural, grapefruit juice, interacting with one of the most commonly prescribed medications for seniors, statins. Drugs like atorvastatin, Lipitor, simvastatin, Zocor, or levastatin, Mevacor, are regularly prescribed to manage cholesterol, but when combined with grapefruit or grapefruit juice, they can create a serious and sometimes life-threatening condition. What makes this combination particularly dangerous is that many people don't consider food and beverages when thinking about medication interactions. However, compounds in grapefruit called furanocoumarins interfere with an enzyme in your intestines that breaks down many medications, including most statins. When this enzyme is blocked, much higher levels of the statin accumulate in your bloodstream, sometimes equivalent to taking 3 to 5 times your prescribed dose. Consider Robert, a 75-year-old who had been taking simvastatin for years without problems. "I was trying to be healthier, so I started having grapefruit for breakfast and drinking grapefruit juice throughout the day," he explained. Within weeks, he began experiencing severe muscle pain, weakness, and dark-colored urine. His doctor diagnosed him with rhabdomyolysis, a dangerous breakdown of muscle tissue that can lead to kidney failure. "I had no idea grapefruit could affect my medication," Robert said. "The medication insert was so long, I never read through all the warnings. And my doctor never specifically mentioned avoiding grapefruit." What makes this interaction especially concerning for those over 70 is that the risks increase with age. Older adults often have reduced liver function, which further impairs the body's ability to process medications. Additionally, the symptoms of statin-induced muscle damage, like muscle pain and weakness, might be mistaken for normal aging or arthritis, delaying crucial medical intervention. Not all statins interact with grapefruit equally. Rosuvastatin, Crestor, and Pravastatin, Pravachol, are less affected, while simvastatin, levastatin, and atorvastatin have stronger interactions. If you enjoy grapefruit, talk to your doctor about possibly switching to a statin with minimal grapefruit interaction rather than risking taking the wrong combination. Importantly, this isn't just about fresh grapefruit. Grapefruit juice, even when not freshly squeezed, creates the same risk. Some other citrus fruits, like Seville oranges, often used in marmalade, and pomelos, can cause similar interactions, though usually to a lesser degree than grapefruit. If you take statins, carefully check the labels of fruit juices, as some tropical blends or citrus medleys may contain grapefruit juice without prominently advertising it. When in doubt, choose different fruits or juices to avoid this potentially dangerous interaction. Combination 4, benzodiazepines and opioid pain medications, the breathing suppression danger. Perhaps the most immediately life-threatening combination on our list involves two types of medications frequently prescribed to seniors, benzodiazepines and opioid pain relievers. Benzodiazepines like alprazolam, Xanax, lorazepam, Ativan, or diazepam, Valium are often prescribed for anxiety or insomnia, while opioids like hydrocodone, oxycodone, or tramadol are commonly used for moderate to severe pain. Both medication classes independently suppress your central nervous system, slowing breathing and heart rate. When taken together, they can create a dangerous synergistic effect, potentially slowing breathing to life-threatening levels or even causing it to stop entirely. For adults over 70, this risk is significantly higher due to age-related changes in how medications are processed by the body. This dangerous combination has claimed too many lives, often because different doctors prescribe these medications without knowledge of what other providers have recommended. Sometimes a primary care physician manages anxiety with a benzodiazepine while a pain specialist separately prescribes an opioid for back pain or arthritis, creating an unintended but dangerous overlap. Take Margaret, an 81-year-old who had been taking low-dose lorazepam for anxiety for several years. After knee replacement surgery, she was prescribed oxycodone for pain. The surgeon knew about my anxiety medication, Margaret recalled, but said as long as I took everything exactly as prescribed, I'd be fine. What the surgeon failed to consider was how these medications would interact differently in an older adult. Margaret's daughter found her barely responsive the next morning, with dangerously slow breathing. She was rushed to the emergency room, where doctors determined the combination of medications had suppressed her respiratory drive to near-fatal levels. The ER doctor told me that people my age are much more sensitive to these drug combinations, Margaret explained. He said what might be safe for someone younger could be deadly for me. What makes this combination particularly insidious is that the effects can worsen with time as the medications accumulate in your system, especially if you have decreased kidney or liver function. You might feel fine for the first day or two, only to experience dangerous suppression of breathing as the drugs build up in your body. If you're currently taking both types of medications, do not suddenly stop either one, as this can cause dangerous withdrawal effects. Instead, speak with your doctor immediately about safer alternatives or carefully supervised adjustments to your medication regimen. For pain management, non-opioid options might be appropriate, while for anxiety or sleep, behavioral approaches and non-benzodiazepine medications could be considered. If you take either a benzodiazepine or an opioid, make sure every healthcare provider knows about it before prescribing any new medication. This includes dentists, who sometimes prescribe pain relievers after dental procedures without full knowledge of your current medications. If you're still watching this video and finding these insights valuable, please comment number 4 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Now, let's move forward. Combination 5, anticholinergics and memory medications, the cognitive decline risk. Our final dangerous combination involves medications that work against each other while potentially accelerating cognitive decline, a particular concern for adults over 70. This interaction occurs between anticholinergic medications and drugs prescribed to improve memory and cognition. Anticholinergics include many common medications such as certain antihistamines, like diphenhydramine, found in Benadryl and most PM pain relievers, some bladder medications, like oxybutynin or tolterodine, certain antidepressants, some medications for Parkinson's disease, and various drugs for vertigo, motion sickness, and gastrointestinal issues. These medications block a neurotransmitter called acetylcholine, which is crucial for memory and cognitive function. On the other side, memory-enhancing medications for mild cognitive impairment or early Alzheimer's disease, like donepezil, Aricept, rivastigmine, Exelon, or galantamine, Razidine, work by increasing acetylcholine levels in the brain. When these opposing medication types are taken together, they essentially cancel each other out while potentially causing additional side effects. Consider Thomas, a 79-year-old who had been prescribed donepezil for mild cognitive impairment. When seasonal allergies flared up, he began taking over-the-counter Benadryl to help with symptoms and sleep. Within a week, my family noticed I was much more confused and disoriented, Thomas explained. My daughter researched my medications and discovered that the antihistamine was directly counteracting my memory medication while further impairing my cognition. What makes this combination particularly concerning is that many anticholinergic medications are available without prescription, and their cognitive effects can be misinterpreted as worsening dementia rather than a drug interaction. Even more alarming, research suggests that long-term use of anticholinergic medications is associated with an increased risk of developing dementia, making this combination potentially harmful in multiple ways. The risk is heightened for adults over 70 because the blood-brain barrier naturally becomes more permeable with age, allowing more of these medications to reach the brain and cause cognitive effects. Additionally, older adults often have reduced liver and kidney function, resulting in higher blood levels of medications and stronger anticholinergic effects. If you or a loved one takes medication for memory or cognitive function, it's essential to review all other medications, prescription and over-the-counter, for potential anticholinergic properties. Common hidden sources include PM versions of pain relievers, which often contain diphenhydramine, over-the-counter sleep aids, motion sickness medications, and even some cold and allergy remedies. For those experiencing bladder issues, talk to your doctor about alternatives to anticholinergic bladder medications, which are among the strongest anticholinergics and can have significant cognitive effects. Non-drug approaches or medications with different mechanisms of action might be appropriate alternatives. If you need allergy relief, consult with your doctor about newer generation antihistamines like loratadine, Claritin, cetirizine, Zyrtec, or fexofenadine, Allegra, which have much lower anticholinergic activity and cross the blood-brain barrier less readily than older antihistamines like diphenhydramine. How to protect yourself, the medication review plan. After learning about these 5 dangerous combinations, you might be wondering how to ensure your own medication regimen is safe. Here's a straightforward plan to protect yourself. First, create a complete medication list including everything you take: prescriptions, over-the-counter medications, supplements, patches, eye drops, and even topical creams. Bring this list to what I call a medication review appointment with your primary care provider. This should be a visit specifically focused on reviewing your medications, not combined with other health concerns that might limit discussion time. Second, ask direct questions about potential interactions. Don't assume your doctor or pharmacist has automatically checked for every possible interaction, especially if you see multiple specialists or use different pharmacies. Sometimes electronic health record systems don't communicate with each other, creating dangerous gaps in your medication safety net. Third, consider using a single pharmacy for all prescriptions when possible. This creates an additional layer of protection, as the pharmacy system can flag potential interactions even if they come from different doctors. Many pharmacies also offer medication review services with their pharmacists, providing another opportunity to catch dangerous combinations. Fourth, be particularly cautious about medications prescribed during hospital stays or by specialists who may not have your complete medication history. Before taking any new prescription, confirm with the prescribing doctor that they're aware of everything else you take. Finally, review your medications regularly, at least every 6 months or whenever a new medication is added. Your sensitivity to certain drug combinations may increase with age, so a combination that was once safe might become problematic as you get older. Remember that medication management becomes even more important after 70, as physiological changes affect how your body processes drugs. Your kidneys and liver may not clear medications as efficiently, leading to higher blood levels and stronger effects. Additionally, you may become more sensitive to certain side effects due to changes in brain chemistry and receptor sensitivity. As we've seen throughout this video, medication combinations that might be relatively safe for younger adults can become dangerous or even life-threatening after 70. The 5 combinations we've discussed, blood thinners with NSAIDs, ACE inhibitors with potassium supplements, statins with grapefruit juice, benzodiazepines with opioids, and anticholinergics with memory medications, represent some of the most common and dangerous interactions that affect seniors. What makes these combinations particularly concerning is that they often involve medications that are individually appropriate and beneficial. It's the combination, not necessarily the medications themselves, that creates the risk. This highlights the importance of coordinated care and open communication between all your healthcare providers. If you're currently taking any of the combinations we've discussed, don't panic and don't suddenly stop taking your medications. Abrupt changes can sometimes be more dangerous than continuing temporarily while developing a safer plan. Instead, contact your healthcare provider promptly to discuss your concerns and explore safer alternatives. The most important takeaway is that you must be your own advocate when it comes to medication safety. No one else has the complete picture of everything you take unless you share it. By staying informed, maintaining an updated medication list, asking questions, and seeking regular medication reviews, you can significantly reduce your risk of dangerous drug interactions. Thank you for joining us today. We'd love to hear from you. Leave a comment below and share one thing you learned today and how you plan to use it in your life. Your thoughts are important to us, so don't hesitate to share them. Reading your comments gives us great motivation and encouragement. If you enjoyed this video and found it helpful, please like, subscribe, and share. Your support helps us continue creating good content to inform and inspire you. Thanks for watching, and we look forward to seeing you in the next video.